Okay, good afternoon, everyone. Welcome to the Health Committee. I'm Senator Jarrett Kilhokalole, Chair of the committee. This Zoom meeting and YouTube live stream event will include the following agenda: the Friday, February 12th, 2021, 1 p.m. health agenda. The members of the committee who are attending are Vice Chair Senator Rosalind Baker, Member Senator Joy San Buenaventura, Senator Kurt Favela, and we also have Member Senator Sharon Moriwaki, who I believe will be joining us shortly. This meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to the viewing options for all Senate meetings on the live and on-demand video page of the legislature's website. In the unlikely event that we must abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, February 17th at 1:10 p.m. and a public notice will be posted on the legislature's website. For those of you who are testifying remotely, all testifier audio will be muted and video will be disabled until it is your turn to testify. We do have a 2-minute testifier limit per testifier. If you run up on that limit, I will kindly ask you to summarize your conclusion. And we ask that you respect that so that we can move expeditiously through the agenda. If there are temporary technical glitches during your turn, please be patient, stand by. We may move on to the next person, but we will try to come back to you. I will be reading a list of people who have submitted written testimony for each measure. We apologize if the closed captioning doesn't accurately transcribe your name. If you're interested in reviewing the written testimony, please go to the legislature's website at www.capitol.hawaii.gov. You will find a link to testimony on the status page for each of the measures. So let's get right to it. The first measure on our agenda is Senate Bill 827 relating to breast cancer screening. This increases categories of women required to be covered for mammogram screenings. It requires the existing health insurance mandate for coverage of low-dose mammography to include digital mammography and breast tomosynthesis. It defines digital breast tomosynthesis and requires healthcare providers to be reimbursed at rates accurately reflecting the resource costs specific to each service, including any increased resource costs after January 1st, 2021. Okay, first up we have HMSA in opposition.
Aloha Chair, Vice Chair, and members of the committee. My name is Lindsay Garcia from HMSA. We stand on our testimony and are available for any questions.
Thank you very much. Offering comments, the Department of Health.
Thank you, Chair. I'm Lola Irvin representing Dr. Libby Char with the Department of Health, and the Department of Health offers comments. We want to note that we do have a breast and cervical cancer screening program funded with the federal dollars, and that we follow the U.S. Preventive Services Task Force guidelines, and we've actually hyperlinked that on our testimony. So based on those guidelines that were published in January 2016, we do make an exception for screening women who are in their 40s, who have a close relative, a parent, sibling, or child with breast cancer. And so we do make a recommendation of following the U.S. Preventive Services Task Force screening guidelines. So thank you for the opportunity to provide testimony.
Thank you, Lola. We have up next, we have Dr. John Loris Wade in support.
Thank you for this moment to speak. The Hawaii Radiologic Society stands on its testimony with the following addition. One piece of published testimony on the legislative website deserves comment. In its written opposition to this bill, HMSA, quote, appreciates the intent of this measure, close quote. HMSA then goes on to state, quote, we offer breast cancer screening benefits for our members that are aligned with national guidelines from the U.S. Preventative Services Task Force. HMSA deserves thanks for illustrating precisely why this committee needs to pass this bill. If the United States Preventative Services Task Force guidelines were followed, insurance companies would no longer be required to pay for screening mammography in women ages 40 to 49. This is because the United States Preventative Services Task Force assigns a grade of C for mammography in this age group. These recommendations have been roundly condemned by most professional medical societies. In point of fact, the federal government has basically belayed these recommendations with a series of protecting access to life-saving screening measures at the federal level. In addition, if these guidelines were followed, insurance companies would no longer have to pay for mammography on an annual basis for women ages 50 to 70, as the guideline only calls for payment for mammography for every other year. So anyway, the Federal PALS Act currently blocks insurance companies from dramatically limiting screening exams. Finally, I would like to state that there is no additional mandate. The bill as written only protects access that is already in place. Thank you. Any questions?
Thank you, Doctor. Up next, we have the Insurance Commission, Mr. Hayashida.
Good afternoon, Chair, members of the committee. The department stands on its written testimony, offering comments, and will be available to answer any questions. Thank you, sir.
Thank you. We have the Hawaii Medical Association, Elizabeth Ann Ignacio, in support.
Aloha, Chair. The Hawaii Medical Association stands on our testimony and are available for questions.
Thank you very much. The Hawaii Radiological Society, in support. Dr. Scott Grosskreutz.
Thank you, Chair, and I'm surprised you're able to pronounce that name correctly. so, this is Scott Grosskreutz here, the Hawaii Radiological Society president. So basically, the U.S. Preventive Task Force guidelines, very poorly serve the women of Hawaii. We have a very diverse population. Recent research coming out of Harvard Medical School and other institutions have shown that minority women, Asian women, Hispanic women, and Black women have an earlier onset of breast cancer. In fact, in these group populations, a third of these women develop breast cancer before age 50. And if you include the number of women who are younger in that age group, the peak age of diagnosis is before age 50. So screening starting at age 50, as per the U.S. Preventive Task Force's guidelines, after the peak, diagnosis really makes no sense for our population. So we appreciate the fact that Hawaii's entire congressional delegation strongly supports the PALS Act and screening at age 40. The other big challenge we have is that women who are at higher risk for breast cancer should really be screened earlier. So language in the bill to encourage early, assessment of risk for breast cancer at age 30 is really important, because what we so frequently see, and especially on the outer islands where you have a lot of women don't have OBGYNs or primary care folks, is high-risk women are walking into our clinics at 36 and 42 and 48 with these large palpable breast cancers, and they've got metastatic adenopathy, and unfortunately their prognosis is quite poor. So thank you for considering this bill. The baseline screening mandate, if that's deemed to be a new mandate, that's something that could be dropped, although many states have baseline screening mammography at age 35. And that was part of the American Cancer Society guidelines and followed throughout the United States for several decades. So those are my comments. I'd be happy to answer any questions.
Thank you, Doctor. I take great care to try and get long, complicated last names pronounced properly. Up next, we have Kaiser Permanente offering comments.
Good afternoon, Chair Keohokalole and Vice Chair Baker. Jonathan Ching for Kaiser Permanente. We will stand on our testimony offering comments. Kaiser does support the intent of this bill. On that note, we would request an amendment with regards to page 5, lines 13 to 14. There's a little bit of a distinguishment between an annual and a baseline. A baseline is the first, it would be the patient's first mammography screening. So we would ask that if the committee moves this measure forward to adopt our amendment. We're available for any question. Thank you.
So noted, Mr. Ching. Thank you. For the Hawaii Society of Clinical Oncology, Blake Oshiro, in support. Okay, actually, I think that's all the testimony we've received from individuals who indicated they would be present. So before I read the names of individuals who submitted written testimony who are not present, is there anyone else on the conference who would like to testify on this measure SB 827? Okay, so in support, we have the Hawaii Society of Clinical Oncology, the Hawaii Primary Care Association, Planned Parenthood Votes Northwest and Hawaii, the Hawaii Women Lawyers, Melissa Martinez, Veronica Rooks, Dr. Christian Welch, and also offering a late supportive testimony, Hawaii Pacific Health, the Pacific Radiology Group, Dr. Martha Weidman, Gregory Dunn, Leighton Pang, and Andy Chan. And I also like to note the opposition testimony from the Hawaii Association of Health Plans. Members, are there any questions on this measure? Okay, we're going to move on to the next item on the agenda, Senate Bill 25 relating to medical care for minors. This permits minors to consent to medical care related to the diagnosis or treatment of HIV or the prevention of HIV. It provides that a minor under certain circumstances shall not be liable for payment for treatment or prevention of HIV. Up first, the Department of Health in support.
Good afternoon, Chair, Vice Chair, and Senators. I'm Tim McCormick testifying on behalf of Health Director Dr. Elizabeth Char. The department appreciates this opportunity to testify in strong support of this important bill. You have a written testimony, but we would like to take a moment to underscore the department's strong support for permitting minors to consent to HIV-related medical care and services, including for prevention of HIV. Medications that can be taken by an HIV uninfected individual to prevent acquisition of HIV are highly effective and were approved for use in minors in 2018. This bill addresses a critical gap in current statute by permitting minors to consent to medical care related to the prevention of HIV when they are unable or unwilling to involve their parent or guardian. Thank you, and I'm available for any questions you may have for the department.
Thank you very much. Next, we have Kaiser Permanente in support.
Aloha, Chair and Vice Chair. Jonathan Ching again for Kaiser Permanente. We will stand on our written testimony in strong support of this measure and do request an amendment. It does note, we do note that page 1 and 2 of the bill do define that a healthcare provider is someone that is licensed to provide permitted to provide healthcare in Hawaii. And so as such, we would like to see conclusions for physician assistants in there. Thank you very much.
Thank you. Next, we have testifying for the LGBT caucus of the Democratic Party of Hawaii, Michael Goliu Jr.
Good afternoon, Mike. Yes, Michael Goliu Jr. and Chair of the LGBT caucus. This is one of our priority bills for this session. We thank you for hearing this bill. It is a grave concern that we ensure that our minors are able to seek medical care for HIV and HIV prevention. The decision for a minor to come out should not be the decision for them to be able to seek medical care. So those are two separate things, and they are something that we think that this bill will help address. And if you have any questions, I will be here for an answer. But again, thank you on behalf of the LGBT caucus for hearing this bill.
Thank you very much. That's all the testimony we've received on this bill from individuals who indicated they would be present. Is there anyone else on the conference who would like to testify? Okay, seeing none, I'd like to note the supportive written testimony of the Hawaii Health and Harm Reduction Center, Malama i Keola Health Center, the Hawaii Youth Services Network, Pride at Work Hawaii, also supportive testimony from Mike Goliu Sr., Natalia Panova, Lynn Robinson Underko, Thaddeus Pham, Tammy Whitney, Justin Salisbury, Nikki Ann Yee, Linda Kim, opposition testimony from Yulia Muschenko, and late testimony in support from the Hawaii Academy of Physician Assistants. Members, are there any questions? Okay, seeing none, we will, Senator Favela.
Let's take a little bit more understanding on the bill. So when they go in for the care, how does the minor pay for it?
Is there a
The
testifier
question,
here?
any of the healthcare people that's supporting it, I just want to know how the minor is going to pay for the treatment and prevention.
Chair, this is Jonathan Ching from Kaiser Permanente. May I respond
Yes,
to? So, Senator Favela, there is a provision in the bill that would ensure that the minor is not liable for payment. You know, the current portion of HRS 577 already, you know, this would strike in contrast to that. So typically for protected, for certain services that minors of this age are able to consent to treatment without their parent or guardian, the minor is typically liable for those to pay for those services. This bill does say specifically for treatment of HIV, the minor is not liable. So then the burden would fall back on either the healthcare provider or the insurer to pay.
Okay, that's the reason I'm asking. So the medical of the parents, or they're going to have a special medical for just for that treatment, that the healthcare provider will help them get the treatment and they don't have to worry about the parents paying. Is that what you're saying?
Yes. Yes, this section of statute, and there was an amendment, I believe, that the legislature made last year for certain services. Minors are protected, and it does not go back to the parent, you know, for payment. And the health plans, you know, I think last year the health plans resolved that these are confidential. You know, there are some forms that need to be done, but I believe at least for Kaiser, we have confidential communication forms that the minor would sign to ensure that no bill goes back to the parent. And you know, these are things that the legislature has put into statute. And I think some of the previous testifiers, we want to ensure that, you know, for the certain services, there's for a vulnerable population of minors, they're able to access, you know, healthcare services.
Thank you, Mr. Ching. Members, any other?
Appreciate it.
Any other questions, members? Okay, seeing none, we're going to move to the next measure on the agenda, SB 1086. This relating to the Hawaii Health Authority, this abolishes the Hawaii Health Authority. First up, we have for the Department of Budget and Finance, Director Craig Kirai in support.
You have our written testimony, Chair Keoho Kalole. We're available to answer any questions.
Thank you very much. Next, we have Dennis Miller in opposition. Okay, and also for Foresight Policy Analysis, Thomas Brandt in opposition.
Sorry to interrupt, Chair. Dennis Miller is present. He's right there on the screen.
Oh, I'm sorry, I can't see. Go ahead, Mr. Miller.
Okay, thank you very much. I'd like to oppose this bill to abolish the Hawaii Health Authority. And one of the reasons I'd like to oppose it is based on some of the reasons that are brought forward for the Hawaii Health Authority not being needed. Some of the reasons for why it's not needed are made by insurance officials who state that there is no savings to be had from administrative simplification. And supporters of the Hawaii Health Authority maintain that, in fact, as is evidence around the world, there is much savings to be had from administrative simplification. Now, there's one particular statistic which is used by our MedQuest Hawaii department, which needs to be examined. The statistic is that the 5 private contractors for Medicaid spend 93% of their funds on healthcare, leaving only 7% for administration. Therefore, there is no savings to be had from simplifying administration. That statement deserves scrutiny because that figure of 93% spent on healthcare is including medical management, which is not healthcare. Therefore, please ask to see the balance sheets to verify for yourself how that figure of 93% being spent on healthcare is arrived at. You will see it is in fact an inaccurate statement being used to mislead the legislature, mislead our governor into not believing that simplifying health insurance will in fact lower costs. Please look at what Connecticut's Medicaid department did about 8 years ago. They threw out their private contractors for Medicaid, hired one of them, gave them—
Mr. Miller?
Yes, 12 seconds. Connecticut hired one insurance company, gave it a simple admin system, lowered costs, increased provider participation. And the Medicaid Department of Connecticut is eager to share a Zoom with this committee, the Health Committee in Hawaii, on how they did it. So please take them up on their offer. And in the meantime, please oppose this bill. Thank you very much.
Thank you, Mr. Miller. Next, Thomas Brandt.
Yes, Chair. Can you hear me?
Yes, please proceed.
Thank you, Chair and committee members. I strongly
please
oppose
activate your
SB
video if you're possible.
I'm sorry, it's malfunctioning. Apologize. I strongly oppose SB 1086, and for the following reasons, I'm asking this committee to schedule SB 983 relating to healthcare for hearing by the deadline next Tuesday. Abolishing instead of fully using the Hawaii Health Authority will guarantee that Hawaii taxpayers and healthcare consumers will continue to pay more than necessary for less actual healthcare, in my opinion, and only the HHA, not SHPTA or private health insurance companies, can change this. This is also beyond the scope of the limited but still necessary role of SHPTA. Several Star Advertiser guest op-eds have clearly explained how self-insuring healthcare for state and county active and retired employees and Medicaid recipients could save taxpayers about $850 million annually, over half our state's projected budget deficit, while reducing the need to furlough or lay off state and county government employees. Almost all other states self-insure one or all taxpayer-funded healthcare plans, and the Hawaii State Association of Counties supports this. Private insurers' value-based capitation payment systems are also worsening Hawaii's doctor shortage, while increasing the number of local doctors who will not accept new Medicaid and now even new Medicare patients. Hawaii doctors now spend too much time on their computers instead of with their patients, and Hawaii doctors, according to surveys, place the blame on HMSA's payment transformation process, which started about 5 years ago. Our current third-party health insurance system also paradoxically rations healthcare for excessive denial of care and cherry-picking patients based on their pre-existing health problems and the quality or lack thereof of their health insurance, much more than state government self-insured systems would, which could also provide better coverage for more people at less cost. While the increase in unemployment due to the COVID
Mr. Brandt,
pandemic—
please conclude.
Okay. The legislature could save $850 million by considering self-care. Experts in other states who do use self-insurance are willing to consult with the legislature as well as EUTF and Medicaid administrators in Hawaii. Thank you very much.
Thank you, Mr. Brandt. That's all the testimony we've received from individuals who indicated they would be present. Are there any other members of the public on the conference who would like to testify on this measure, SB 1086? Okay, seeing none, I'd like to note the written testimony, all of it in opposition, from Americans for Democratic Action, the Progressive Democrats of Hawaii, Martha Nakajima, Scott Garris, Philip Verhoff, Stephen Kemble, Marion Poye, Daria Fan, Ed Felian, Dr. Scott Grosskreutz, and late testimony in opposition submitted from the Hawaii Committee, the Health Committee of the Democratic Party of Hawaii, and Young Progressives Demanding Action. Members, are there any questions? Oh, I'm sorry, Melody, I see you on the call. Would you like to testify?
Yes, thank you very much, Chair Kalole and Vice Chair Baker. I appreciate this opportunity to testify in opposition to this bill. I have submitted testimony, and I just want to say that the Health Committee of the Democratic Party of Hawaii has worked very diligently on a lot of the policies that have been set forth by the Hawaii Health Authority. And we feel very strongly about it. And we've held several forums for the past several years. And as a committee, we have pushed for the Hawaii Health Authority to be funded and reactivated at least for the last 4 years. And I've been chair of the committee now for going on 2 years. And we've been communicating with the governor, the lieutenant governor, and of course, Kathy Betts and Judy Moore Peterson on several occasions, Linda Chu Takayama as well, as there's a lot of policies that the Hawaii Health Authority has put forth that have a lot of merit. And these policies are not standalone, but they do have state precedents, especially those that involve the EUTF, where we've got 29 other states that use the self-insured, state-insured method in which millions of dollars have been saved as a result. And this is also true with the MedQuest or Medicaid program, where we've got precedents from other states, particularly Connecticut, in which millions of dollars have been saved, when minimally it appears that just being able to have these systems, EUTF as well as Medicaid, go from a managed care operator to an administrative services only, that in and of itself would save the state millions of dollars. And given the circumstances, given the budget, given COVID and the pandemic.
Ms. Aduha, can you please conclude your remarks?
Yes, Chair. Thank you very much. At this time, we only request that this bill be deferred. It is there's good things that the Hawaii Health Authority has produced and will continue to produce. And the Democratic Party Health Committee would like this bill to be deferred at this time. Mahalo, Chair.
Thank you very much. Is there anyone else on the conference I missed? Okay, members, questions? Okay, seeing none, we're going to move to the next measure on the agenda, SB 279, relating to marriage of minors. This raises the minimum age requirement to enter into marriage from 16 to 18 years of age. It also removes the parental consent and written approval by the family court requirements for a minor to marry, and removes the spousal cohabitation after the parties attain legal age as an exception for an annulment based on nonage. First testifier we have is the Department of Health offering comments.
Good afternoon, Chair Lauren Kim, Legislative Director, testifying as Acting State Registrar. The Department has submitted comments by way of data to help this committee make a decision on this matter. Otherwise, we take no position on the policy. Thank you.
Thank you. Next, we have Amanda Parker in support.
Thank you, Chair. I'm the Senior Director for the AHA Foundation, where we work to end harmful practices, including forced marriage and child marriage in the U.S. I'm here in strong support for SB 279, which would end all child marriage in the state without exception. The current minimum age of marriage in Hawaii is 18, but the state allows for 2 major exceptions. Children ages 16 and 17 can marry with parental consent, and those who are 15 can marry with parental consent and judicial approval. The parental consent loophole is absurd. In AHA Foundation's experience, when a child is forced to marry, the perpetrators are almost always the parents. So parental consent is often parental coercion. It's also just a signature on a form. It does nothing to protect children from forced marriage. We've heard horror stories from our partners in this space about survivors of forced marriage who cried openly while their parents forced them to marry under a parental consent exception, and the clerk in most of those situations never even looked up. The judicial review process also does not protect children from forced marriage. The law does not specify any criteria a family court judge must consider before approving the marriage of a minor. This gives courts wide discretion to approve, for example, the marriage of a child who is too young to consent to sex, or the marriage of a child to an adult who is a registered sex offender. The solution is not to strengthen the judicial review process. Even the most robust judicial review process has a fatal flaw. It puts the onus on children to find a safe way to communicate to a judge that they are being forced into marriage. We have worked with many survivors of forced child marriage who underwent a judicial review process, and for them, the process just caused further trauma. They faced a horrific decision: be honest with the court and face the repercussions from their parents when they get home, or lie to the court and feel complicit in their own forced marriage. The parental consent and judicial approval processes effectively disempower children, allowing adults to enter children into marriage and providing little or no recourse for children who do not. I urge each of you to vote favorably to advance SB 279. Thank you so much.
Thank you very much. Next, we have testifying in support for the Small Business Association Leadership Council, Jareda Torres.
I testify today as an individual citizen, disabled veteran, mother of a Down syndrome child, and as a Small Business Association Leadership Council representative. My testimony is simple. Washington politics are finally aligning with social justice, and I implore Hawaii State Legislature to integrate those same alignments with the implementation of SB 279. I'm from the Washington, D.C. area and work tirelessly and passionately to advocate on behalf of special needs children, a forgotten niche within the most vulnerable population. SB 279 does not just protect underage children, but also protects minors who might otherwise be incapable of distinguishing subpar adult motives. You are not alone in standing up for basic human rights. The good news is that here in Washington, underage marriage and the general plight against pedophilia is no longer unnoticed or taboo. I have seen the great bipartisan strides being made to end these atrocities, including support from the private sector. America's Small Business Association Leadership Council is meeting this week and next to address these same sensitive issues that are applicable in our background investigations. We need courage on both sides of the aisle and to listen when the people speak up about issues that matter, like preventing underage marriage. Thank you for your time and consideration.
Thank you very much. Just to note, we do have a number of testifiers on the call for this measure. The testimony has been provided to the members. So we have read it already. It's not necessary for you to read it out verbatim, but we do encourage you to utilize your 2 minutes to testify as you please. Next, we have Frady Rice in support.
Thank you. I am Frady Reese. I'm the founder and executive director. Oh, no problem. I get that a lot. With Unchained at Last, which works to end forced and child marriage in Hawaii and across the United States through direct services and advocacy. And I'm testifying today as both a forced marriage survivor and an expert whose research and writing on forced marriage and child marriage have been published widely. I urge you to vote yes on SB 279. There are many reasons to end child marriage, but I want to focus on one. Child marriage can too easily be forced marriage. And that's because the age of majority in Hawaii when a child becomes an adult is 18. And children who have not yet reached the age of majority can very easily be forced into a marriage, even at 15, 16, or 17, even if they're really, really mature, because of their limited legal rights. So let's start, for example, with the ability to leave home. Children in Hawaii can be charged with a status offense if they leave home before 18 to escape from parents who are planning an unwanted wedding for them. Now, children are automatically emancipated upon marriage, but the law does not specify whether that gives them the right to leave home to escape from an abusive spouse. That is unclear in the law. And besides, where would they go? Domestic violence shelters across the US routinely turn away unaccompanied minors because of the potential legal liability that minors bring. Those who are escaping a forced marriage often have complex legal needs we see at Unchained, but contracts with children, including retainer agreements with children, with attorneys are voidable. And so only the most generous attorneys would agree to represent a child. Now, automatic emancipation upon marriage does grant minors some rights of adulthood, which likely includes the right to enter into contracts, but those rights arrive too late, only after the marriage is granted, which means that a minor who is facing after the marriage is approved. So a minor who is facing a forced marriage has to endure the trauma of the forced marriage, which often means being pulled out of school, raped on their wedding night, before they then get the right to retain an attorney and try to get out of their unwanted marriage. We ask minors to wait until 18 to enter into almost any other contract. So we must also ask them to wait until 18 to enter into a marriage contract to be sure that they have the basic legal rights that they need to protect themselves from forced marriage. Thank you.
Thank you very much. Next, we have Sarah Wright in support.
Good afternoon, Chair Kehoe-Kalole. I hope I'm pronouncing that correctly, Vice Chair, and thank you to members of the Hawaii Senate Health Committee. I'll keep my remarks very brief. Of course, I support Senate Bill 279 for all the reasons that Frady just explained, and also in particular because we know that child marriage laws undermine statutory rape laws, I should say. And as Frady just mentioned, the age of consent to have sex in Hawaii is 16. So an adult who has sex with a 15-year-old commits sexual assault in the first degree and or the third degree if they are not less than 5 years older than the child, unless they are legally married. In other words, the marriage license is a get out of jail free card. Once it's issued, what would otherwise be considered sexual assault becomes perfectly legal and is sanctioned by the state. So we really very strongly support Senate Bill 279. Thank you.
Thank you very much. Next, we have Max Robbins in support.
Mr. Chairman and distinguished committee members, thank you for considering SB 279 and giving me the opportunity to provide testimony. My name is Max Robbins, and I am the founder and executive director of Students Against Child Marriage, the nation's only 501c3 nonprofit that fights the American child marriage crisis through student activism. We're a relatively new organization with nearly 40 chapters, more than 450 members, and over 7,000 supporters of all ages across the country, including right here in Hawaii. Simply put, child marriage is a human rights abuse. This practice has devastating, lifelong consequences for girls. The US State Department has even gone so far as to call marriage before 18 a, quote, human rights abuse. The negative impacts of child marriage are profound. Girls who marry in the US before 19 are 50% more likely than their unmarried counterparts to drop out of high school, and over 4 times less likely to graduate college. Women who marry as teenagers are 3 times as likely than women wed as adults to have at least 5 children. And girls in the US who marry young are 31% more likely to live in poverty when older. These studies controlled for other variables. Child marriage is the problem here. If that's not enough, women who marry in the US as children face a 23% higher risk of significant health complications such as heart attacks, diabetes, cancer, and strokes than do those married between the ages of 19 and 25. This is what happens when a child is forced to raise a household. That's not even to mention the prolonged psychological complications and frequent domestic violence child marriage survivors suffer through. Mr. Chairman and the members of this committee, child marriage is unequivocally a human rights abuse. The nation's youth urge you to vote yes on SB 279 and end child marriage in Hawaii now. Thank you.
Thank you very much. Next, we have Rima Nashashibi in support.
Aloha Chair, Vice Chair, and other distinguished senators. My name is Rima Nashashibi, and I'm the founder and president of Global Hope 365, and I rise to speak in support of SB 279. Global Hope 365 is a 501c3 nonprofit organization dedicated to ending harmful practices against women and girls like child marriage and human trafficking. You heard my esteemed colleagues, and you will hear from survivors of child marriage. But I would like to bring your attention to 2 things. I'll be very brief. I submit to you that the American Medical Association has called for an end to child marriage, stating child marriage is associated with higher degrees of sexually transmitted infections, early pregnancies, infant and maternal mortality, divorce, and intimate partner violence than women married at age 21. In addition to a higher rate of other issues, medical and health and emotional issues. The United Nations Office on Drugs and Crime issued a report recently on the interlinkages between child marriage, forced child marriage, and human trafficking, which we all know involves fraud, force, and coercion. So it was observed that marriage could be linked to each of the acts listed above in the definition of trafficking, that is recruitment, transportation, transfer, harboring, and receipt. More specifically, the act of recruitment in relation to marriage cases is often connected with deceptive means. Marriage can also be linked to the transportation or transfer of the victim, for example, by her family or third parties to the husband and his family, who then receive and harbor her and sometimes put them in servitude. So thank you for your time, and I urge you to vote in support of SB 279. Mahalo.
Thank you very much. Next, we have Dawn Tyree in support.
Aloha from the Oregon coast, the rainforest. My name is Dawn Tyree, and I'm a survivor of child marriage. I was forced to marry my 32-year-old nanny when he got me pregnant. By 15 years old, I had 2 children, and it was at that time that I began to plot my way out of the marriage. My marriage was an automatic emancipation. However, I was powerless over my body. I had no rights, and not one adult spoke to me about birth control. When I tried to leave, I couldn't get a hotel room, and I was turned away from shelters. Social services advised that I go home to my parents, but my parents had disowned me. Law enforcement threatened to return me because my husband had reported me as a runaway. My children and I lived below the poverty line for many years. More over a decade. We lived without toilet paper at times, without shampoo, and often without electricity. How was I to think about trying to go to college when we were barely surviving? 16 years old with 2 children. I can tell you from my personal experience that even if there had been a mandated court investigation, I wouldn't have spoken up against my family. I wouldn't have accused my abuser of being a rapist. And I wouldn't have mentioned that my parents had abandoned me. I'm going to talk about the child marriage in Hawaii. Child marriage is a widespread problem in Hawaii, especially for girls. Unchained at Last research showed that 811 children, some as young as 15 years old, were married in Hawaii between 2000 and mid-2020. Some 82% of those were girls married to adult men. Why is that happening? Across the US, child marriage is a significant problem. Unchained at Last research again showed that an estimated 248,000 children as young as 12 years old were married in the United States. And that's in 10 years, from 2000 to 2010. And almost all of them were girls, again, wed to adult men. I was 13 years old and married.
Ms. Tyree, thank you for your remarks. I have to ask you to conclude, please.
Thank you. That's all I have. Mahalo.
Okay, thank you. Next, Michelle Hanash in support.
Good afternoon, and thank you for the opportunity to testify. My name is Michelle Hanash, and I'm the Director of Policy and Advocacy at Unchained at Last. I'm testifying today in support of SB 279, the important bill that would end the devastating practice of child marriage in Hawaii, and I will focus my testimony on the dangers of automatic emancipation. Marriage at 15, 16, or 17 is extremely harmful and dangerous. And that is true even though a child in Hawaii is currently emancipated upon marriage. And here's why. Automatic emancipation does nothing, absolutely nothing, to prevent the forced marriage because the minor facing a forced marriage is not yet emancipated. So a child must first undergo the trauma of the forced marriage, which means being raped on her wedding night and likely pulled out of school before she has the right to escape. You cannot unrape a child by later emancipating her. And the state of Hawaii is a party to the subjugation of that minor by issuing that marriage license. Marriage at 15, 16, or 17 is extremely harmful and dangerous. And that's true as we just mentioned, even though the child is emancipated. And one of the reasons is because of how dangerous automatic emancipation is. It likely ends the parent's financial obligation even without evaluating the child's financial or emotional independence or educational needs. Hawaii does not have an automatic emancipation statute that lays out a process for a minor to seek emancipation outside of marriage. In other states, minors who seek emancipation must typically first prove to the court that they are financially and emotionally independent, and the court looks at none of this when emancipating a child because of marriage. Further, 70 to 80% of child marriages end in divorce. So if a child marriage ends in divorce, as it's likely to do, then that child can be abandoned and is ill-equipped to support herself or the children she now likely has. At Unchained, we have seen children emancipated through marriage and divorced before 18, then end up homeless when their parents refuse to allow them back home. Marriage before—
conclude your remarks.
Thank you. Marriage before 18 brings devastating lifelong consequences for girls, and those repercussions do not disappear if we stamp emancipated on a girl's forehead. So emancipated or not, child marriage is far too dangerous, and a child can wait to marry just as they would to enter into any other contract. And so for those reasons, I urge you to advance SB 279 and vote yes for those reasons. Thank you.
Thank you very much. Sarah Tasneem, in support.
Aloha, distinguished committee members. My name is Sarah Tasneem, and I am a survivor of forced child marriage. I'm a vocal national advocate to end forced child marriage in the United States because of the horrors I had to endure as a child with absolutely no escape, legal or otherwise. I hope that no other child must go through what I did, and that is why I support SB 279. At the age of 15, I was forced into a marriage I did not want. My father introduced me to my husband-to-be one morning, and I was told that I would marry him that night. That man was 13 years my senior. He was 28 years old. After a spiritual wedding ceremony that evening, I was handed over to my new husband and left in his care. I was not allowed to go back to school. My opportunities were taken from me, like so many other victims of child marriage. Marriage before the age of 18 makes children much more likely to be pulled out of school than their adult counterparts. 6 months after our spiritual ceremony, I was legally married at the age of 16 and pregnant. My pregnant belly should have alerted authorities to a rape instead of a rubber stamp on a marriage certificate. I was not advised of my rights or even asked if I wanted the marriage. None of it felt like a marriage. It felt more like a prison. It took me 8 long years of surviving my abuse and overcoming enormous obstacles to file for divorce. It took me 3 years to finalize that divorce. As a minor, I faced extreme and numerous barriers to being able to leave my abusive marriage. I am not the exception. In fact, minors who marry are 3 times more likely to be abused within their marriages. It has taken me years to recognize and address the severe impacts, and I suffer from PTSD and anxiety. It will take me years to recover. There are so many reasons why child marriage is harmful to minors, and I can't think of one good reason why Hawaii would want to continue these harms and expose minors to a human rights abuse. Thank you very much.
Next, we have Aliyah Abbas in support.
Yes, hi, Chair. I hope I'm pronouncing your name correctly. Good afternoon, Chair Kia Kalole and distinguished committee members. My name is Aliyah Abbas, and I am a child marriage survivor and activist. As a child marriage survivor, I request you and urge you, please, to vote yes on SB 279 because it will simply put an end to child marriage. Voting yes would mean eliminating the abuse of placing children in the most vulnerable, hopeless, abusive, and dangerous situations, even though the marriage age in Hawaii is 18, 15, 16, and 17-year-olds can marry with parental consent. When a child is forced to marry, the perpetrators are almost always the parents. Parental consent is often parental coercion, as were in my case. I wholeheartedly support this bill because it hits home. It's extremely personal. I I am a former child bride, so I know the reality of this injustice. At 17 years old, I was taken out of school in 2003, and I was flown to a foreign country, married to a complete stranger. I was left there. I was used as a puppet by a bunch of oppressive adults. But before that, I received the marriage talk at the age of 13. I was verbally committed to a 30-year-old man at the age of 16, which broke off. So that one instance of marriage changed my life forever. I was raped at my wedding night. I was raped again when I got pregnant for the first time. I had a DNC. I was raped again where I had my son, and then I was raped again and I had my daughter. So, being a mother is the most fulfilling job that I have, but it took every ounce of my being to raise my children all by myself, to fight for the divorce, to get myself out of that situation, even when the risk was death, because that's what my uncle told me, that girls in our family and our culture do not divorce, they die. But I took the risk because I took it for my children the most. I wanted them to be free. And it's been the hardest. I can't explain to you what I went through during the marriage. I was bullied, I was beaten, I was raped. And then after the marriage, having to raise 2 children by myself, solo, without family, without a community, without any support. I was very ambitious, so I put myself through college, but that took me taking my children to college with me, first with my son and then with my daughter in the double stroller, and then taking them to work with me when the daycare would not accept them when they were sick, and then having to make rounds trying to feed my daughter, who would not take the bottle or the dropper for her milk. So it's been a struggle. I do not want any other girl to go through this, the burden of a child marriage, and then the divorce is unimaginable. So I please urge you guys to vote yes on SB 279. Thank you so much for this time.
Thank you very much.
You're so welcome.
That's all the testimony we received from individuals who indicated they would be present. Is there anyone else on the conference who would like to testify on this measure? Okay, seeing none, I'd like to note the supportive written testimony from Stephanie Markle, Vivian Hamilton, Patricia Billick, Nisha Abiraj, Reed Maki, and late testimony from Marcy Hamilton, Allison Gill, Hawai'i Zonta International, Robbie Melton, and Edie Ignacio Newmiller. Members, are there any questions? Senator San Buenaventura.
For Lauren Kim, if he's still on Zoom. Health Department.
Yes, Senator, how can I help you?
Okay, so I looked at your written testimony and it looks like less than 1/10% are of the minors who marry are of Hawaii residents. So are you saying then the majority of these child marriages are people who flew into Hawaii to get married? Or at least one of them?
At least one of them. So we ran the data for the last maybe 10 or so years. And the data that we submitted, and we're happy to send the underlying data tables to you so that you can look at the raw data yourself. We had a couple of search criteria, one being any minors, and then another criteria was at least one is a resident of Hawaii. And according to our data, it's mostly teens marrying teens, but there are some very clear outliers that beg scrutiny.
Okay, so I just want to make sure, we can probably clear up a number of this if we just require both parties to be residents. Because you're talking about less than 1/10%, right?
As a fraction of all the marriages. So in any given year, there are 20,000 marriages. So that's the end.
Okay. Oh, that's of all marriages.
Yes, I'm sorry if that's not clear. Not of child marriages, but of all the marriages. So I'd be happy to send the data to you and order it in any way that would be more helpful.
How many of these child marriages are between 10 to 21 years age, I mean, over 10 years difference? Do you know?
It was a relatively small number. It did raise an eyebrow. Like I said, the majority are teens marrying teens or individuals within 3, 4, 5 years of each other. There were, out of the 200 or so, maybe 5 to 10 that were a teen and someone in their late 20s, and there were 4 or 5, if I recall correctly, that were between a teen and somebody in their 40s. Yeah.
And that is around 4 to 5 of the 216?
Yes,
is that
Senator.
what you're saying?
Yes.
And I have one last question, and I don't know whether or not you looked into it. How many of these child marriages, that the 216, do you know where there was a TRO or any kind of domestic violence or a CPS claim?
Sorry, we don't have that information. This data was pulled from marriage license and marriage certificates. And I'm not aware of a data system to which we have access where we could make that correlation. We can maybe work with the AG and the judiciary, send them a list of names or to do a verification, but I don't have access to those kinds of data.
Okay, so Department of Human Services, and I did not ask for a re-referral on this one, and it just slipped through my exam with the, but Department of Human Services did not submit a report as to how many CPS complaints or domestic abuse complaints occurred from any of these child marriages, huh? As far as you know.
I'm not aware of any. I'm sorry, Senator.
Okay. Okay, thank you very much.
Thank you, Senator.
Members, any other questions?
Yeah, Chair, I got a question for.
Go ahead, Senator Favela.
Is he still there?
Senator Favela, go ahead.
Yeah, the question is, when they come out yesterday, what happened?
Is it for the Department of Health?
No, something wrong with my video, sorry.
You're
It's
good
for the
now.
Department of Health. Sorry, I just wanted to make sure my video was on while I speak. When they apply for the marriage license and you see the, I'm not saying a discrepancy, but you see that the age and the requirement, like you say, you guys get the parents' consent or signature or whatever it is. Do you guys, by case basis, even try to investigate anything further on this children that is getting married by parent consent on the underage?
I'm not aware of any legal authorization to do so. Certainly there is maybe a moral obligation to ask some questions. However, in my capacity as acting state registrar, our role is ministerial, meaning we process the form, which is why I'm not taking a position. But I am not aware of any follow-up questions we ask as long as the right signatures are in place. There is follow-up if something clearly looks fraudulent, if it looks like the handwriting does not match, we will ask questions. Maybe we would refer it to the Attorney General. But to my knowledge, I'm not aware of a case that happened recently where we would pursue that. These are very small numbers we're talking about.
Yeah, the reason why I'm bringing this up, so if for me, if I would marry somebody that's not a citizen, yeah, and they come and they live with me from, let's just say Philippines, and I marry them, and they're the right age, they're over 21, and I marry her. The process of me marrying somebody from another country, they go through some very stiff criticism and observation. That's the reason why I asked the question, because to me, this should have been really looked into because the parents giving permission, the child is still a child, and it should have been a little bit more scrutiny between any of the state agencies. I think that's where I think we let these children down. So I'm really happy for something like this bill to really protect our young people going forward. Thank you, Chair.
Chair, if I may, I'm happy to follow up with our sister agencies to perhaps have an informal protocol if something like this crosses our marriage license agents. Like I said, I think we have some kind of, at least a moral obligation to make sure that this is legitimate. And even if it's legitimate, ask those questions. So I'll commit to taking that back, at least for an informal protocol. Thank you.
So just to clarify, Lauren, what you're saying is that pursuant to the statute, there's no mandate here for the Department of Health to verify, aside from that the form was filled out properly and the signatures were by the individuals who claim to be the person on the paper. There's no mandate by law for the department to investigate whether there's some sort of coercion or abuse in these situations.
I'm not aware of any legal obligation to do so, Senator.
Okay. Okay, Senator Tan Buenaventura.
Sorry, one more. Okay, thank you, Lauren Kim. I'm sorry, you're the only actual Hawaii resident who's testifying about this bill and the only person from the state. So I apologize if it's not within your purview. But you know, I practice family law and I've been doing it for 30 years. And one of the things that for older adoptions, which has similar kind of concerns as to whether or not the adoption is going to, for like even adult adoptions, okay, because there are adult adoptions, is that Department of Human Services is required to actually investigate some of these, I mean, all adoptions. Would something like this, shouldn't the statute then be, instead of just a family court consent, which I think is supposed to be the safeguard against abuse, shouldn't there also be a Department of Human Services investigation like we have in our adoption law?
Well, I can't speak for the Department of Human Services, but I think it is a conversation worth pursuing, especially given some of the serious nature of the testimony that we've heard today. If there are opportunities to make sure abuse is averted, again, we have a moral obligation to have that conversation. And so I'll take that back and discuss that with colleagues from the Department of Human Services and see what kind of proposals we can come up with.
Okay, thank you, Lauren.
Thank you, Senator.
Okay, members, any other questions on this measure? Okay, seeing none, thank you very much. We are going to move to SB 732, relating to the Nonviolent Response Team pilot. This directs the Department of Health to create a 2-year Nonviolent Response Team pilot project and proposes to appropriate monies. First, we have Robert Merce in support. Okay, also indicating they were present, the Department of Health.
Good afternoon, Chair, Vice Chair, members of the committee. Thank you for letting me testify on this bill. While we thoroughly support the intent of this measure, we have opposed it for the reason that much of what this pilot is asking the department to do is already in place and ongoing. And in this era of fiscal uncertainty, we thought it prudent to focus primarily on the things that we have going right now and beefing those up and continuing to work on those. I have looked at all of the testimony and support, and I'm extremely grateful for that testimony. I'm extremely grateful for the support of the legislature. And what it tells me is that I have not done a good enough job letting folks know what we've actually accomplished in the last year. So I will endeavor to do better at that. Thank you, Chair.
Thank you very much. That appears to be all the testimony we've received by individuals who indicated they would be present. Is there anyone on the conference who would like to testify on this measure, SB 732?
Chair, this is Bob Merce.
Oh, hi there. Please go ahead.
Okay, my name is Bob Merce. I just wanted to supplement my written testimony briefly. I was the chair, vice chair of the House Concurrent Resolution 85 Task Force on Prison Reform. We issued 2 reports, and in our first one to the legislature in 2018, we recommended that the state of Hawaii have an emergency mobile response team exactly like this for a couple of reasons. One is that the people who are in crisis, who get taken to a cell block or a jail, studies show that they don't get the treatment they need. Secondly, it's an inappropriate place to put somebody who is in crisis because of the conditions there, the noise, the violence, and the chaos typically, and that they end up staying a lot longer than the general population. So this was 3 years ago, and I'm happy to see a bill that stands the possibility of getting an organization, a response team like this. It's something we really need. Thank you very much.
Thank you. Is there anyone else who would like to testify on this measure? Okay, I'd like to note the written testimony in support from Martha Jenkins, Joseph Brown, Carrie Ann Shirota, Carla Allison, Raylan Reno Yeomans, Courtney Morozinski, Jackie Esser, June Shin, Jennifer Ahia, Ralph Garcia, and late testimony from Will Karen, Ned McKnight, Jeannie Wheeler, Shannon Rudolph, Christopher Egbo, Thomas Brandt, Mary True, Karina Carnes, Doris Matsunaga, Natasha White, and Barry Chun. Members, any questions? Okay. Seeing none, we're going to move to the next measure on the agenda, SB 975. This measure is relating to pharmacy audits. That establishes procedures for audits of pharmacies conducted by a healthcare provider, insurance company, third-party payer, sickness insurance provider, mutual benefit society, and others. First, we have the Department of Health offering comments.
Thank you, Chair. This is Lauren Kim, Policy Director for DOH. We've submitted comments supporting the intent to bring PBM regulation to the forefront. We do recommend that Section 328-106, which is in DOH's chapter, be repealed in its entirety because it creates a parallel, confusing, and potentially conflicting set of PBM regulations. Thank you very much.
Thank you. EUTF, Derek Mizuno, offering comments.
Hi, good afternoon. Good afternoon, Chair, Vice Chair, and members of the committee. I'm Derek Mizuno, ETF Administrator. Just raising concerns about some items in the bill that would restrict the PBM's auditing rights. The monies do come back to us as a plan that CVS or the PBM collects on our behalf. Thank you, and I'm open for questions. Thank you.
Thank you, Mr. Mizuno. Next for CVS Health, Annie Makapagal, offering comments.
Aloha. Aloha, Chair. Annie Makapagal on behalf of CVS Longs. Thank you for the opportunity to submit comments on this measure. Generally, we have concerns and we want to ensure that this bill will not open the door to fraud or wasteful spending in healthcare. These audits are used to ensure that pharmacies are complying with the Board of Pharmacy rules and regulations. It serves as a safeguard to patient safety. And with that, we'll stand on our written testimony. Mahalo.
Thank you. Next, we have Kaiser Permanente in opposition. Okay, that's all the testimony we've received from individuals who indicated they would be present on the conference. Did I miss anyone? Okay, I'd also like to note the written supportive testimony from the National Community Pharmacists Association, Molokai Drugs, Inc., Times Supermarket, Times Pharmacy, Trenton Seed for PAAS National, Greg Harmon for Kamehameha Pharmacy, and Patrick Adams. Members, any questions? Okay, seeing none, we're going to move to the last item on the agenda. We have a little bit of a challenge. We have 10 minutes left on our conference time, and there are a number of individuals who have indicated they would be present to testify on this measure. In all likelihood, we will not have the time to get through everyone, which will require us to delay decision-making on our agenda and actually vote on another day, which will likely be Wednesday, February 17th. at 1 p.m. With that said, and with the indulgence of the members, I would like to take testimony from the individuals who took the time to register to testify and registered to be on the Zoom conference with us right now. But because we do need to be finished with the agenda by 2:30, we're going to have to push the vote off to Wednesday, February 17th at 1 p.m. Okay, first, in support from the Hawaii State Commission on the Status of Women, Kara Jabola Carolis. Okay, by the way, I'm sorry, this is SB 618 relating to parentage. This amends the Uniform Parentage Act to allow non-gestational partners to voluntarily establish parentage of a child during the period immediately prior to or following the birth of the child. LGBT caucus of the Democratic Party of Hawaii.
Good afternoon. Real briefly, we stand on our testimony and support, and we encourage you to pass this measure. Aloha and have a great evening. Good afternoon.
Thank you very much. Affirm Hawaii in support.
Aloha Chair Keoho Kalole, Vice Chair Baker, and esteemed members of the committee. You have our written testimony before you. We'd just like to briefly take some of our time to acknowledge the pain of the survivors of child marriage that shared their stories, and thank you all for sharing your stories and their bravery. Just briefly, we'd like to highlight the urgency of this issue. Hawaii is known as being a state that is on the forefront of LGBTQ justice and LGBTQ rights because of our strong history and standing in support of LGBTQ people, and particularly gay marriage. But this does not erase the reality that discrimination against LGBTQ folks in Hawaii is actually quite alive, rampant, and thriving. One instance is in the UPA, or the Uniform Parentage Act, which discriminates against LGBTQ parents who are whole, valid, and real, but treated as wrong according to Hawaii state law. The UPA only allows male partners of people for unmarried couples giving birth in hospitals to voluntarily establish their parental rights at the time of birth. And LGBTQ folks and parents are forced to obtain expensive and emotionally invasive post-birth adoption decrees that cost thousands of dollars. This is known as the queer parent penalty. And as we sit here today, hundreds of beautiful babies have been born to loving queer parents throughout the duration of the COVID-19 pandemic. And many have faced extreme hardship in finding the financial means to obtain these post-birth adoption decrees. And this has prevented LGBTQ families and parents from enrolling their children in healthcare benefits, preschool programs, government benefits, etc. And the pandemic has only highlighted and illuminated the unjust expectation that LGBTQ parents are not regarded as valid in the eyes of the law. SB 16 is the fix that we need for a future without LGBTQ oppression. We're available and willing to take any questions. Mahalo for your time and dedication to this issue.
Thank you very much. I really have to apologize to the testifiers. We have 1, 2, 3, 4, 5, 6, 7, 8 more testifiers and not very much time. I'm going to have to ask that the remaining testifiers keep their remarks to 1 minute in order to just allow everyone who's on the call to speak. We are also going to delay decision-making on our 1:15 p.m. agenda from today to Wednesday, February 17th at 1:15 p.m. Please proceed, Monique DeSimone.
The Uniform Parentage Act, as it currently stands, discriminates against queer families and our ability to establish parental rights under law without unjust burden. I strongly urge you to pass this measure and to end the unconstitutional restriction on the equal rights of LGBTQ+ people and our path to parenthood. As a lesbian parent who recently welcomed my son, Teddy, last June, I speak firsthand to the hardship of pursuing a family as an LGBTQ+ couple, from locating a donor that ethnically represented our family and provided uncontested legal protection against paternity disputes, to finding a medical provider who did not actively discriminate against us. On top of the cost of fertility procedures, there were countless hurdles we faced along the path to building our family, both emotionally and financially. As a non-gestational parent to Teddy, there were many hours spent consulting with lawyers regarding the security of my parental rights in various scenarios as a non-biological parent. I'm no less his mother than the woman that birthed him, yet every step of the way I am questioned because I'm not a cis hetero man. LGBTQ+ people already face tremendous obstacles on this parenthood journey. Forcing us to additionally spend upwards of $20,000 to adopt our own children is discriminatory and cruel. The state is failing their LGBTQ+ families. It is shameful that this law is outdated and that the state has allowed for this discrimination to continue to happen. Countless queer families have likely had to drain their life savings to bring a child into a loving home if they are privileged enough to even do so. Some state agencies have pushed back on this bill, stating issues ranging from clerical in nature to conflicts with laws involving deadbeat dads, reminding us yet again that the system was built to serve and revolves around cis heterosexual men. Biology and gender identity in marriage should not be determinants of who is granted the opportunity of parenthood under law, nor are they markers of what makes a family legitimate. Queer parents know better than anyone that family goes beyond biology. If male partners have the ability to volunteer parenthood, queer partners should be able to do the same. Mahalo for your opportunity to testify, and I strongly hope that the state can go beyond empty promises of LGBTQ+ equality by enacting SB 618.
Thank you. Junshin, in support.
Yes, thank you, Chair, Vice Chair, members of the committee. I'll just keep it real quick. My name is Jun Shin, and I am in strong support of this bill. As a straight cisgender male, just wanted to offer my strong solidarity with female, non-binary, and queer parents who are not afforded the same rights that I have under the law. And I just ask you to pass this bill because they deserve the same legal recognition, rights, and benefits that my potential family would have under the law. Our laws really need to catch up. Thank you so much for the opportunity to testify.
Thank you very much. Ashley Galakak, in support.
Aloha, Chair, Vice Chair, and members of the committee. My name is Ashley Galakak, and I strongly support this bill. As a queer woman from the LGBTQ community, this directly impacts my life and my partner. Being born and raised here, my partner and I dream to raise our children here in Hawaii, where our families are. I've heard a lot of stories from friends and colleagues, and through their experiences, they serve as an inspiration to me to not only learn from the hardships, but also fight against a systemic injustice they have suffered. Under this disgraceful and shameful law, only male partners of birthing people are afforded the option to volunteer themselves as a legal parent and establish parenthood on their birth certificate. 618 amends the unconstitutional restriction for equal rights. 618 codifies love, acceptance, and equal treatment of loving couples like my partner and me. Adopting gender neutral, or I think gender full language, such as parentage, in place of paternity is in recognition of the validity of all birthing people and families. 618 would update the law to give legal protections and recognition, and I'm asking your leadership to protect LGBTQ communities and give us the rights that we deserve. Thank you for your time.
Thank you very much. Next, we have Jamaica Osorio, in support.
Aloha, my name is Dr. Jamaica Heoli Kalani Osorio. I'm an assistant professor of Indigenous and Native Hawaiian politics at the University of Hawaii at Manoa. And my life and research is devoted to the politics of Hawaiian relationships, intimacy, and the violence of colonialism on our understanding of Pilina and Ohana. I'm also a queer wahine who lives under the tyranny of the state of Hawaii, and so I feel uniquely positioned to offer testimony in support of SB 618. I encourage you to pass this bill for many reasons, including that it will help to eliminate some discrimination against LGBTQ+ parents and families, but also because it eliminates or works to eliminate an important ongoing discrimination against Native Hawaiian parents and Ohana. Esteemed scholars such as Lili'kalaka Lehiwa laid the groundwork for our understanding of the specific values of Ohana, in which paternity was an entirely insufficient metric to rely on in organizing and legitimizing Hawaiian families. In fact, negotiating parenthood, or to be makua, has much more to do with the environment and Ohana created to raise a child rather than the biological circumstances that conceive that child. We have so many examples of this, from Kamehameha or to your own Kupuna Senator Keoho Kalole Li'o Kalani, demonstrating how incomplete the laws and values of marriage and birth are to the ways we imagine and organize our Ohana. More recently, we point to the not so subtle violences of missionary introductions, such as the institution of marriage has had on generations of Kanaka Maoli families. Suffice to say that the existing laws around marriage and parentage in Hawaii are a legacy of missionary colonization that is continuing to this day to exclude and violate the historic values of Ohana that many of us Kanaka are still fighting to keep alive. So today I ask you to pass this bill, not only because it is the right thing to do for queer families, but because it would be an important step against the ongoing colonization of Hawaii and the continued oppression of our people's histories and values. Self-determination over our ohana, our ability to appropriately name the makua of our children without the interference of the state and foreign values, is a practice of sovereignty. This work is essential to the goals of anyone who wishes to honor the ike and values of our home in Hawaii. An opposition who would rather cling to stale notions of the sanctity of marriage and paternity over the rights of Kanaka Maoli practices of ohana to continue on our aina can simply choose to live somewhere else. For where else should Kanaka Maoli turn to live as Hawaiians, if not on our own ancestral land in Hawaii? Me ko'e i'o, mahalo.
Thank you very much. At this point, I'm very sorry to the testifiers. This is our first year doing remote. We are about to lose the feed. What I would like to do is stop here and circle back to the testifiers who indicated that they would be present and intended to testify. We will reconvene. We will defer decision-making on this matter, and I will allow the individuals who we are not able to get today to participate if they are able to make it on Wednesday, February 17th at 1 p.m. We are also going to defer decision-making on SB 602, which was the 1:15 agenda today, to Wednesday, February 17th at 1:16 p.m. Again, I apologize. This is the first agenda where we ran over our time, but I do not want folks to be testifying live on YouTube and their feed be cut off mid-testimony. So we will ask the folks who we missed today to please join us on Wednesday. We will circle back to you to try to get that Zoom information, and we'll finish testimony then. With that, members, we are adjourned.